Aging is a universal process, but it doesn't unfold in exactly the same way for everyone, and one of the most consistent and biologically meaningful distinctions is between men and women. At the cellular, hormonal, and metabolic levels, aging tends to proceed differently based on biological sex, and this divergence also shapes how individuals respond to anti-aging interventions. These differences are not just superficial or cultural, they are embedded in our genetics, our immune systems, and even the rate at which our organs decline. As a result, a growing body of research is now focused on the importance of sex-specific approaches to longevity, recognizing that what works well in men may not work the same way in women, and vice versa. On a cellular level, women tend to have longer telomeres than men on average, which may contribute to their generally longer lifespans. Women also tend to have more robust immune systems early in life, in part due to the influence of estrogen, which supports immune function and mitochondrial health. However, this stronger immune activity may also make women more prone to autoimmune conditions. In contrast, men typically experience earlier declines in testosterone and muscle mass, and their mitochondria may show signs of dysfunction slightly earlier. These biological differences mean that the aging process often involves different vulnerabilities. Women may face more rapid bone density loss and hormonal volatility during menopause, while men may experience a steeper decline in cardiovascular health or cognitive resilience after midlife. When it comes to interventions, these biological distinctions also appear to shape the response to popular anti-aging compounds. Take caloric restriction, for example, a well-known longevity strategy that consistently extends lifespan in animal studies. While it improves metabolic markers in both sexes, some studies suggest that women may experience more hormonal disruption with severe caloric restriction, potentially impacting fertility and thyroid function, even at older ages. Similarly, supplements like NAD+ boosters or resveratrol may influence estrogen and testosterone pathways differently, potentially requiring sex-specific dosing or combinations to maximize benefits and minimize side effects. Pharmaceutical anti-aging treatments like metformin and rapamycin also show variable effects based on sex. In some rodent studies, rapamycin extends lifespan more dramatically in females than in males, possibly due to differences in mTOR signaling or liver metabolism. Meanwhile, metformin appears to lower mortality risk in both sexes, but may affect mitochondrial pathways differently, depending on hormonal background. These nuances point to the need for clinical trials that are not only inclusive of both sexes, but are also designed to analyze outcomes through a sex-specific lens, something that has historically been overlooked in biomedical research. Hormones play a pivotal role in these differences, not just during reproductive years, but across the lifespan. Estrogen has powerful antioxidant properties, supports DNA repair, and helps maintain vascular and skin health, all of which decline sharply after menopause. This has sparked interest in whether hormone replacement therapy, HRT, when carefully timed and personalized, could be used not just to ease menopausal symptoms, but to actively support healthy aging in women. Similarly, testosterone replacement in aging men is being reevaluated, not only for libido or muscle mass, but for cognitive function, cardiovascular health, and even telomere maintenance. Psychological aging, too, shows subtle sex-linked patterns. Women often report higher rates of depression and anxiety, which can influence biological aging through stress hormones and inflammation. However, they may also benefit more from emotionally focused therapies and mind-body interventions that reduce chronic stress. Men, on the other hand, are often less likely to seek mental health support, yet may show strong biological benefits from exercise-based or purpose-driven longevity interventions, which address stress in more action-oriented ways. All of this suggests that the future of anti-aging medicine may need to move beyond a one-size-fits-all model. Personalized longevity strategies, tailored not only to genetics, lifestyle, and age, but also to biological sex, are likely to be more effective and safer. Such approaches could optimize the timing, type, and dosage of interventions based on hormonal status, mitochondrial health, and immune profile. Whether it's fasting regimens, adaptogenic herbs, hormone support, or cutting-edge therapeutics like senolytics or stem cell treatments, the ultimate goal will be to align treatment with the unique aging trajectory of each individual. In a world where personalized health is increasingly valued, recognizing the role of sex differences in aging is not just scientifically responsible, it's essential. Men and women may walk parallel roads toward longevity, but the landscapes they navigate are different. By honoring those differences, We can design anti-aging therapies that are not only more effective, but more inclusive, ensuring that everyone has the opportunity to age not only longer, but better.